I'm Eugenia Gianos. I'm the director of the Women's Heart Program at Lenox Hill Hospital and the director of cardiovascular prevention at Northwell Health. The one thing I would tell women to know is that cardiovascular disease is largely preventable, and you don't have to have a heart attack or a stroke in your life. So if you just take the time to understand your family history and who is at risk and what your baseline risk is, and you work during your lifetime to make certain changes and improve your lifestyle and get on the right therapies, you can entirely change the course of your life. I can tell women to do is to really advocate for themselves, something that many of us don't do so easily and have to learn. One, for their health, if they're having any symptoms that they're concerned about, that they need to get checked out, that they shouldn't downplay them and that they should really make that a priority. But also in their lives, there's so many things that we are trying to balance nowadays and help other people and do the best at our jobs. But the reality is we can't do any of that if we don't advocate for ourselves and protect ourselves. The 7 key lifestyle areas that are risk factors for heart disease are blood pressure, cholesterol, sugar, weight, smoking, diet, and exercise. The good thing is that we can improve most of them with lifestyle and with working with a program. The most important thing to keep in mind is that these are things that we need to address early in life. It's an interesting thing that we've learned over time, that it's really your exposure to these abnormal risk factors over your whole life that puts you at risk. So the earlier you get started at targeting these, the better you'll do over the long term. Anytime a woman has symptoms, she should think about going to see a cardiologist to get checked out. That goes without saying. But when it comes to prevention, there are certain things that should prompt a woman to see a cardiologist or even a preventive cardiologist nowadays. So a strong family history, early heart disease in multiple family members, high cholesterol, risk factors that are not well controlled, different things that might be putting you at risk should really prompt you to see a cardiologist or a preventive cardiologist early in your life. These are things that if you get to someone early enough, you can prevent the process of plaque buildup throughout your body. The most important thing to keep in mind is that in 2/3 of cases, the symptoms of a typical heart attack between men and women are the same. It's crushing chest pressure, some sweatiness, shortness of breath, feeling fatigue and out of it. But in women, about 1/3 of the cases don't have the classic chest pressure. So women may just say, I just felt exhausted, or I had shortness of breath or nausea or stomach upset. Things that are not exactly what we would have attributed to heart disease, and those are the ones that get missed. But for women, those are actually classic symptoms as well. So we just all need to be aware of that, both physicians and patients. Well, I always tell my patients and friends and family members that if they're ever unsure about what their symptoms are from and worried that this could be something serious, they should just get checked out. It's better to get to an ER or to an urgent care or to your doctor's office and find out that fortunately this was just heartburn or this just was stress. But the truth is that if you don't get checked out and it is something serious, the problem we have is that there's only a certain period of time where we can actually save either the heart muscle or the brain in the case of a stroke. So it is essential to get checked out early on. And I always tell them, if it was nothing, you can blame it on me. Tell them I told you to go, but it's really important to get checked out. The most important thing we're doing in terms of raising women's heart health is changing the way we practice. I think the first way to target this issue is really to design our practices in a way that tailor to women. So We have questionnaires that ask the appropriate questions about a woman's history that may put her at risk for heart disease. We also ask about all the lifestyle elements and the family history to get that full picture when we first meet the woman. The other things that we're doing is that we partner with multiple services that offer programs for women to target diet, stressors in life, psychosocial aspects, so that we really are changing not just the medical therapy we provide, but the overall therapy. We also partner with the Katz Institute for Women's Health, which provides an entire structure for education and support for our patients. And lastly, we are using our large health system at Northwell Health and a lot of data that we can then learn about sex-specific differences in patients. I happen to love the slogan that the American Heart Association came up with, Reclaim Your Rhythm, because it means so many wonderful things, actually. I think predominantly it is about movement and physical activity and dancing and moving and music, but it's also about reclaiming your rhythm when it comes to mental health and wellness and well-being, and really stopping and thinking at a time, when we've all been through a lot during this pandemic, on both the good and the bad things in our lives, on what we can improve, on how we can change the way we approach our lives to improve things moving forward. So I think, we're all working in different ways to reclaim our rhythms, and in our practices, we're offering support on all of those levels, both the message of why this is important, but also programs to help women to do this. So when it comes to stress, it's interesting to know that there is great scientific evidence that, in large studies, psychosocial stressors were pretty much similar to even things like diabetes and smoking when it came to the degree of heart disease they were associated with. So this is real, and it is something that we absolutely need to target in order to improve cardiovascular health. So how to do that? One, finding out about services out there, working individually with somebody who can guide you, a psychologist, perhaps a psychiatrist. And then, separate from that, just all kinds of wellness in terms of meditation, in terms of groups, finding exciting, fun things to put on your calendar, being with friends and family, things that will help to improve your mental health. So this is absolutely a key thing. Social support is such an important thing in terms of wellness that we can't forget that piece of the pie when we're thinking about cardiovascular health. We all need to find balance in our lives. I think we tend to be in a society where we go to extremes, extreme diets, extreme exercise, really long work hours. And I can tell you that the patients that I'm seeing really are struggling with a lot of these different aspects. And I think it's so important for all of us, and particularly women, to stop and figure out how can we achieve that balance, really, because every aspect of that is important to health. Your sleep, your exercise, your diet, your community, your friends, your work environment, and sort of thinking about how can we, in small steps, really move towards making improvements in every aspect of that little by little to really achieve a great balance in our lives that'll help our heart health, but that will really just improve our lives.